Top 5 Anti-Inflammatory Foods for Joint Pain Relief. Hello, and welcome back to the channel. If you or someone you love is over 60 and dealing with joint pain, stiffness, or inflammation, you're not alone. Millions of older adults experience chronic joint discomfort that affects their mobility and quality of life. But what if I told you that your next meal could be part of your medicine? Today, we're diving into the top 5 anti-inflammatory foods that can help relieve joint pain, improve flexibility, and support long-term joint health. And don't worry, this isn't a boring nutrition lecture. We'll explore real stories, scientific evidence, and practical tips to help you feel better one bite at a time. Grab a comfy seat and maybe a healthy snack because you want to take notes on these powerful foods. 1. Fatty fish, the omega-3 powerhouse. First up on our list is fatty fish. And no, I'm not just talking about fish that are a bit on the plump side. I mean fish that are rich in omega-3 fatty acids, like salmon, mackerel, sardines, and trout. These little swimmers are like superheroes for your joints because they're packed with EPA and DHA, two types of omega-3s that have been shown to reduce inflammation. Inflammation is your body's natural response to injury or infection, but when it becomes chronic, it can wreak havoc on your joints. Conditions like rheumatoid arthritis, RA, and osteoarthritis, OA, are driven by this persistent inflammation, leading to pain, stiffness, and reduced mobility. Over time, it can even damage the cartilage and tissues in your joints, making movement painful and difficult. Fatty fish are a fantastic source of omega-3 fatty acids, which have been scientifically proven to combat inflammation. A study published in Arthritis and Rheumatology found that higher intake of omega-3s from fish was associated with a lower risk of developing RA. For those already living with RA or OA, omega-3s can help reduce joint stiffness and tenderness. In fact, research in the Journal of Nutrition showed that omega-3 supplements significantly improved joint function in RA patients. Let's meet Sarah, a 45-year-old office worker who started experiencing joint pain in her hands and knees. Her doctor diagnosed her with early-stage RA, and she was determined to manage her symptoms naturally. After learning about the benefits of omega-3s, Sarah began including salmon in her diet twice a week. Over a few months, she noticed a significant improvement. Her morning stiffness was less severe, and she could move more freely. Sarah's story is a testament to the power of simple dietary changes. Omega-3s work by reducing the production of inflammatory molecules and substances like cytokines, which are signaling proteins that fuel inflammation. They also help lower levels of C-reactive protein, CRP, a marker of inflammation. A review in the journal Nutrients highlighted that omega-3 fatty acids can modulate the inflammatory response, making them particularly beneficial for inflammatory diseases like arthritis. You can grill, bake, or pan-sear fatty fish for a delicious meal. If fresh fish isn't your thing, canned sardines or salmon are just as nutritious and super convenient. The Arthritis Foundation recommends aiming for at least 3 to 4 ounces of fatty fish twice a week. It's like treating yourself to a tasty meal while also taking care of your joints. Talk about a win-win. 2. Berries, nature's anti-inflammatory gems. Next up are berries. Those vibrant, flavorful little fruits that are as delicious as they are healthy. Strawberries, blueberries, raspberries, and blackberries are all packed with antioxidants, particularly anthocyanins, which give them their rich colors and powerful anti-inflammatory properties. Oxidative stress occurs when there's an imbalance between free radicals and antioxidants in your body, leading to cell damage and inflammation. This is a major contributor to joint pain and conditions like arthritis. Over time, oxidative stress can accelerate the breakdown of cartilage and worsen joint symptoms. Berries are loaded with antioxidants that help combat oxidative stress and reduce inflammation. A study published in the Journal of Nutrition found that eating strawberries daily reduced oxidative stress and inflammation in overweight adults. Another study in the European Journal of Nutrition showed that blueberry consumption decreased inflammatory markers in obese individuals who often experience higher levels of inflammation. Take John, a 60-year-old retiree who loves gardening but has been struggling with knee pain due to OA. He decided to add a handful of blueberries to his morning yogurt every day. Over time, he noticed his knee pain was less intense, allowing him to spend more time in his garden without discomfort. John's experience shows how easy it can be to incorporate these tasty treats into your routine for noticeable benefits. The anthocyanins in berries have been shown to inhibit inflammatory enzymes like COX-1 and COX-2, which are involved in the inflammatory process. They also reduce the expression of genes linked to inflammation. Research from the University of East Anglia found that flavonoids, particularly anthocyanins, may protect against inflammatory conditions, making berries a smart choice for joint health. Berries are incredibly versatile. You can add them to your breakfast cereal, blend them into smoothies, or enjoy them as a snack. Frozen berries are just as nutritious as fresh ones, so they're a convenient option year-round. Aim to include a serving of berries in your diet at least a few times a week for optimal benefits. 3. Turmeric, the golden spice of healing. Turmeric is a spice that's been used for centuries in traditional medicine, particularly in Ayurveda and Chinese medicine. Its active compound, curcumin, is what gives it its vibrant yellow color and potent anti-inflammatory properties. Arthritis, especially RA, involves complex inflammatory pathways that lead to joint damage. Curcumin has the unique ability to target multiple steps in these pathways, making it a powerful tool for managing joint pain and inflammation. Studies have shown that curcumin can be as effective as some anti-inflammatory drugs, but without the side effects. A clinical trial published in Phytotherapy Research found that curcumin significantly reduced pain and improved function in patients with knee OA. Another study in Arthritis Research and Therapy highlighted curcumin's ability to reduce inflammatory markers in RA patients. Maria, a 55-year-old teacher with RA, had been struggling with joint pain for years. After reading about turmeric's benefits, she started taking turmeric supplements daily. Within a few weeks, she noticed less joint pain and improved mobility, allowing her to continue teaching without as much discomfort. Maria's story illustrates how turmeric can be a natural ally in managing arthritis symptoms. Curcumin works by inhibiting the activity of inflammatory enzymes and cytokines. It also blocks the activation of NF-κB, a protein complex that controls the transcription of DNA and cytokine production. A review in the journal Molecules highlighted curcumin's potential in treating inflammatory diseases, including arthritis. You can add turmeric to curries, soups, and even smoothies for a flavor boost. For better absorption, pair it with black pepper, which contains piperine that enhances curcumin absorption. Turmeric supplements are also available, but always consult a healthcare provider before starting any new supplement. 4. Ginger, the spicy soother. Ginger is another spice with a long history of use in traditional medicine. Known for its warming properties, ginger is often used to soothe digestive issues, but it also has strong anti-inflammatory effects that make it a great ally for joint pain. Chronic joint pain, especially in conditions like OA and RA, is often accompanied by inflammation that can make movement difficult and uncomfortable. Ginger's anti-inflammatory properties can help address both the pain and the underlying inflammation. Ginger contains compounds called gingerols, which have been shown to reduce inflammation and pain. A study in Arthritis and Rheumatology found that ginger extract reduced knee pain in patients with OA. Another study showed that ginger supplementation decreased inflammatory markers in individuals with RA. Alex, a 35-year-old athlete, developed tendinitis from overuse during training. He started drinking ginger tea daily and noticed a significant reduction in pain and inflammation around his tendons. This allowed him to return to training sooner than expected. Alex's story highlights how ginger can be a simple yet effective way to support joint health. Gingerols inhibit the production of pro-inflammatory cytokines and reduce the activity of COX-2, an enzyme involved in inflammation. Research from the University of Miami found that ginger has therapeutic potential for treating chronic inflammatory diseases, including arthritis. Ginger can be added to teas, stir-fries, or baked goods for a zesty flavor. Fresh ginger is potent, but ground ginger is also effective. Ginger supplements are another option, but always consult a healthcare professional before starting any new supplement. 5. Nuts, the nutrient-packed snack. Nuts are not only a tasty snack, but also a powerhouse of nutrients. Almonds, walnuts, pistachios, and others are rich in healthy fats, protein, and antioxidants that fight inflammation and support joint health. Chronic inflammation can lead to joint degeneration over time, especially in conditions like OA. Nuts provide nutrients that help combat this inflammation and protect joint tissues. Nuts are rich in monounsaturated fats and omega-3 fatty acids, especially walnuts, which help reduce inflammation. Research published in Nutrients showed that nut consumption is associated with lower levels of inflammatory markers. Another study in the British Journal of Nutrition found that almonds reduced oxidative stress and inflammation in overweight adults. Lisa, a 40-year-old mother with lupus, had been experiencing joint pain for years. She started snacking on a handful of walnuts daily and noticed her joint pain became more manageable. This allowed her to engage in physical activities with her children without as much discomfort. Lisa's experience shows how nuts can be a simple yet effective addition to a joint-friendly diet. The healthy fats in nuts help reduce inflammation by lowering levels of C-reactive protein, CRP, a marker of inflammation. Walnuts, in particular, contain alpha-linolenic acid, LA, a plant-based omega-3 that has anti-inflammatory effects. A study in the Journal of the American College of Nutrition confirmed that nut consumption can reduce inflammation and improve overall health. Nuts can be eaten as a snack, added to salads, or incorporated into baking. Be mindful of portion sizes due to their calorie density, but including a small handful daily can provide significant benefits for joint health. So there you have it, the top 5 anti-inflammatory foods for joint pain relief: fatty fish, berries, turmeric, ginger, and nuts. Each of these foods has been backed by scientific research showing their ability to reduce inflammation and improve joint health. Remember, while these foods can be part of a holistic approach to managing joint pain, it's always important to consult with a healthcare professional for personalized advice, especially if you have specific health conditions or are taking medications. By making these delicious and nutritious foods a regular part of your diet, you're taking a proactive step toward healthier, happier joints. Cheers to that! Don't forget to comment below, what's your favorite anti-inflammatory food? Let's build a wellness menu together. And if you enjoyed this video, like, subscribe, and share it with someone who needs a little joint relief today. Stay strong, stay healthy, and we'll see you in the next video.